5th World AIDS Day as leader of the global AIDS response. And we're here in Melbourne, which in a few months from now will be hosting the International AIDS Conference for the very first time. Tell me, when you think of all that, what's the new opportunity?
We can say today confidently that we are breaking the trajectory of this epidemic. We are seeing a decline in new infections everywhere. We are seeing also increase of number in need of treatment, having access to those basic services. Also, death rate is going down.
You're from Mali in West Africa, which today sits at a major social and political crossroads. Your parents were the first mixed couple to get married in that region as well. What are the stories from that childhood, from that upbringing, which runs in parallel to your fight against AIDS?
For me, my family background has been everything for me. It is this background which helped me to understand that the beauty of diversity, managing diversity, respecting others. And that's why today I'm making a strong call. I said a very strong call for making sure that we don't exclude anyone in the fight against HIV/AIDS.
You love people, and you often say that one of your commitments is to make sure that nobody gets left behind. Yeah. Millions of people in the last decade have come onto treatment, but millions more are still waiting for that life-saving treatment. Look at that gap. How are you going to address it?
Commitment, renewed commitment of our all partners, and that's why I think the replenishment of Global Fund is so critical, mobilizing resources from the north, but also making sure that we have a shared responsibility approach where we have co-financement of our programs by bringing domestic resources more and more into the picture is critical.
My final question is, for people to really inject new energy and to join that fight against AIDS all over the world, how important is it for them to understand AIDS not only as a public health emergency, but to see it also as a fight for everybody?
AIDS is a people-driven issue. It is issues of sexuality, how we really educate our young people, how we make sure that we have a different vision about society, and how we bring equity. Those problems are central to the fight against HIV/AIDS.